Well, thank you, Chair Wyden and Ranking Member Crapo for this hearing, and to all of our witnesses, thank you so much for taking time to be with us today. Dr. Miller, I want to start with a couple of questions to you, and then I'll move on to the other panelists. The demand for mental health and substance use disorder treatment and services skyrocketed during the COVID-19 pandemic as millions of Americans grappled with grief, isolation, and economic uncertainty. We've helped meet that demand by providing new means to access mental health and behavioral services such as telehealth. And there's been a lot of discussion about that this morning. Unfortunately, even as we move to make it easier to access some services, the stigma still associated with substance misuse prevents too many people from getting the behavioral health services they need. Dr. Miller, how does the stigmatization of substance use disorder impact access to treatment and services, and what steps can Congress take to better integrate substance use disorder treatment into primary care settings?
Well, thank you for your question, Senator, and thank you for your ongoing passion and leadership in this space. To your point on stigma, we know that only about 10% of individuals with substance use disorders receive care. And that tells me a lot about stigma. It says both that socially that we don't talk about it as much as we should, but more importantly, however, structurally, we have these fragmented ways of individuals being able to get access to care. One of the themes that I think you're very familiar with and that we've discussed today is that we need to make it easier for individuals who are identified with a substance use disorder to be able to get access care. That means bringing that care to where people are. We have to train up our providers to identify it. We've got to train up our clinicians to treat it. And we've got to recognize that undergirding all of the substance use disorders is also mental health. The reasons that we provide gold standard treatments for things like substance use disorders is because we need to provide counseling at the same time. This is how we begin to destigmatize substance use disorders and hopefully encourage more people to seek care.
Thank you. I'm also continuing to work on trying to change the X waiver requirement as we move forward, because I think that stigmatizes the provision of treatment for some healthcare providers too. Dr. Miller, I want to turn to another devastating public health crisis that we have to work on, which is the issue of youth suicide. A report published yesterday, and Senator Wyden mentioned it earlier, by the CDC found that earlier this year, emergency department visits for suicide attempts by adolescent girls increased 51% on average when compared to 2019. And I've heard directly from New Hampshire students about the mental health concerns that they have. That's why I've introduced the Bipartisan Stand Up Act with my colleague, Senator Ernst. That's going to encourage the implementation of evidence-based policies and trainings in schools and communities across the country that will help to prevent suicide. Dr. Miller, can you speak to the importance of providing kids and teenagers with the tools that they need to recognize if they or someone they know is at increased risk of suicide?
Thank you again for the question, Senator. As a father of two children, I can tell you this is the one that I really want to make sure that we get right. We teach our youth, our kids, all about aspects of physical health. We even teach them things like how to drive a car and even how to save someone's life with CPR. And so, yes, we have to be able to equip our youth and our schools, frankly, where our youth are basically there a lot, with the ways to identify issues related to suicide. In fact, there was one survey that came out from Mental Health America that showed how youth are more talking to each other around issues of mental health, which includes suicide, other than their parents.
Right.
So because our youth are the front lines, we need to equip them with those skills necessary to know how to be there for one another. This, to me, is a way to augment the workforce that we've discussed today. If we simply depend on our clinical workforce to address the demand, especially with our youth, we will fail. We have to be more creative, more thoughtful, and most importantly, we have to have the youth at the table and with us as we design those solutions to work with them on ways that they can better help each other.
Thank you. Dr. Betlock, I want to move on with a question for you. We increased federal funding for home and community-based Medicaid services under the American Rescue Plan. This funding helps ensure that older adults and individuals with disabilities, including those with mental health conditions such as bipolar disorder and schizophrenia, can access mental health services outside of institutional settings. Can you, from your experience as director of the Arizona Medicaid program, speak to the important role that home and community-based mental health professionals play in delivering care for individuals who experience severe mental health disabilities? And what can we do in Congress to expand access to home and community-based care for those struggling with mental health conditions?
Senator, the investment that you made is really a once-in-a-generational investment in terms of where states are at and the ability to leverage that 10% home and community-based bump. And it's really broader, I think, than a lot of people appreciate. It's also on behavioral health services that states deliver through the rehab option as well. And those are incredibly important. So states are right now developing their plans. I'm working with a number of states, and they're generating their options that they want to invest in. So it's an exciting time for states, but states are feeling like there's a very significant time crunch here in terms of being able to establish this investment and do it in the right way. So I think those plans will be evolving, but there's clearly a unique opportunity, and these services are so important to be able to deliver services in the community to serve these populations. So it's an exciting time for states to have these resources, to be looking at workforce issues, to be looking at being able to deliver more services in the community.
Thank you, and thank you, Mr. Chair.